Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Our research-backed videos are engaging, easy to follow, and they help ease the daily challenges like agitation and anxiety so that you can focus on connection and joy. Available by subscription on mobile and TV apps, Zinnia makes every day a little bit easier. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
This is Medicare Moments with your Medicare Moments host, the lovely Toni King. Hi, Toni King.
How you doing, Jim? What's going on?
I'm doing well, Toni King. Today, we're going to talk about something that we don't talk about much on Medicare Moments. My Medicare problem began with a notice from CMS. So let's stop right at those initials. CMS. What do they mean, Toni King?
Centers for Medicare and Medicaid Services. They're the ones that run all the rules.
Well, today you have an email from Zach who writes, "Hello, Toni. When I turned 65, I continued to work with excellent company benefits. I delayed enrolling in Part B for 5 years after I turned 70 and retired with a January 1 effective date from my Medicare Supplement Plan G and Part D prescription drug plan. Now, my Medicare stress has started because I have received a notice from CMS saying they do not have a record of me having prescription drug coverage that met Medicare's minimum standards from March 1st, 2019, when I turned 65, to January 1, 2025, when I retired, and I may receive a Part D late enrollment penalty. I thought applying for Part B with that form from my employer attached kept me from a Part D penalty. Can you please advise me what to do? I want to be sure that I do not make a mistake. Thank you, Toni, Zach, in Lake Jackson, Texas." So what do you have to say to Zach, Toni?
All I can tell Zach is that he's not the only one that gets confused about this. When you're past 65, and you're getting on Part B of Medicare, you're going through, you're filing those forms, you're taking them to the Social Security office, and it shows that you had employer benefit, but it didn't show what you had. And every year you get some kind of a letter saying that your Part D is credible coverage. That's just letting you know that you have insurance that meets Medicare's requirements. So when you retire, you get something coming back saying, what prescription drug coverage did you have prior to you retiring up to the day that your Part A started? And all you got to do is either pick up the phone and call that Part D company, or you fill out the form back to them and let them know you had company insurance from whenever you left work, whatever, January 1st, 2025, back to whatever his day was, March 1st, 2019. And you send that form back to them, and you only have 63 days to do it. If you don't ever send the form back, then your penalty will go all the way back to the day that your Part A started, and his would go all the way back to March 1st, 2019. And he'd get 35 cents a month. Let's say it's 60 months. You'd pay an extra $21 a month.
For the rest of your Medicare life.
The rest of your Medicare life.
So every penny counts, every dollar counts, especially when you're retired and you're living on somewhat of a fixed income. So Toni's going to talk more about this after we come back from this all-important break. Don't go away. We'll be right back.
Hi, everyone. Super Bowl champ Vernon Davis here from Legal Help Center. If you've been injured in an accident and think you deserve compensation, listen up, because we have legal professionals standing by right now to answer your questions for free. You can find out if you have a case and how much it's potentially worth.
Thanks, Vernon. You heard it, folks. If you've been injured, call and find out how much you qualify for. Call 800-497-4410. Advertisement sponsored by Legal Help Center. May not be available in all states.
You're listening to Medicare Moments with your host, Toni King. Toni is the author of the Medicare Survival Guide Advanced Edition. You can find out all about that book and more at Toni's website, which is tonisays.com. That's TONISAYS.com. We want to thank you for listening to Medicare Moments, for sharing this information with your friends, for calling Toni when you need questions answered. She is at 832-519-8664. 832-519-8664. Thank you for writing in. info@tonisays.com. That's info@tonisays.com. And lots of folks read you, Toni, in newspapers all across America. We get emails from the folks reading you in Tampa and other places. And we love to have them as part of our Medicare Moments family. So we're talking about Zach, and we're talking about the notice he got from CMS and how to keep his, quote, head above water and not get a penalty for what he did to enroll in Medicare along the way, right?
That's right. And people get confused because you get that form from work saying that you have credible prescription drug coverage. All that means is that your prescription drugs in your company benefits meets or exceeds Medicare's minimum, that you've got decent insurance. If you don't get the form, then once you sign up for Part A of Medicare, you need to go ahead and get a prescription drug plan. But people get too caught up on it. When they get that letter, they think they've done something wrong. You haven't done anything wrong. All you got to do is turn it back in as fast as possible. I have people that stack up mail and say, oh, I haven't looked at anything in 4 months and I got this form in here. Well, they've waited too long. They only give you 63 days to respond. Open your mail up, and you open it up and you call the number that it's got on there and you tell them I had company insurance through Blue Cross Blue Shield and I'm fine. They'll say, okay, thank you.
That's all you have to do. Now, Toni, what if someone has one of those discount prescription drug programs like from Walmart, Kroger, or GoodRx or Amazon? What about those?
Those are not credible. Creditable.
Oh. Okay.
Those are just discount programs. You can use them to pay your prescriptions, but it's not going to keep you from getting Medicare's Part D penalty. Now, if someone has the VA or they've got TRICARE, they're on a group health insurance, that's credible coverage. Creditable. Not credible like it's good. It's creditable. It meets or exceeds Medicare's minimum, whatever Medicare deems. And every year it changes. So you want to make sure, just say you don't take any prescriptions. Just go and get a cheap prescription drug plan through Medicare or you'll have a penalty. You never know when you're going to have to use cancer drugs. It can happen to the best of us very fast.
It can, and when you least expect it. So as Toni says, be prepared, be proactive. And if you have questions about this, and it's confusing sometimes just to hear it, you're welcome to reach out to Toni. The best way to get someone on her team is to call 832-519-8664, 832-519-8664. Toni's book, The Medicare Survival Guide Advanced Edition, is available on Toni's website, tonisays.com. And you can check that out. That kind of coordinates with today's topic. Chapter 5 of the Survival Guide will give you some answers about how to avoid Medicare Part D penalties. We enjoy you being with us on Medicare Moments. Toni, back to you.
Well, I appreciate it, Jim. And people just need to realize, don't wait too long. Just do it. Just get things done. Don't put it off, because if you wait past 63 days, you're going to have a penalty and you're not going to be a happy camper. Nobody wants a penalty.
Attention seniors. Are you looking for a community that offers incredible benefits and stands up for your values? Look no further than AMAC. With an AMAC membership, you'll enjoy exclusive discounts on insurance, travel, dining, and shopping. Stay informed with 6 issues a year of our award-winning AMAC magazine, delivering trusted news and valuable insights. But that's not all. AMAC is committed to defending America's future by directly bringing the voices of our more than 2 million members to our elected officials. Join a community that cares about your needs and your values. For a limited time, we're offering a 1-year membership for only $1. Yes, just $1 for a year of incredible benefits and advocacy. Don't wait. Take advantage of this special offer and join AMAC today. Visit amac.us/join now. That's amac.us/join now.